Oh gosh, I'm giving myself forehead wrinkles. Um, this is day 8 since the concussion, and every afternoon now, like right now, what I'm experiencing. That's why I'm recording this. Um, my head starts to burn. Well, my head burns on and off all the time, and my ears kind of ring intermittently, but they're not as bad. I don't think. I don't know right now because I'm experiencing what I call a headiness. And that is where I become very, very foggy. Um, and like I said, there's definite, like burning, since that you can feel it burning, which I do believe is healing. I think it's healing, but it feels very, it does not feel good at all. It feels bad. And when I say bad, I mean, it's uncomfortable. It's not and I keep making that, like, crinkling my face. And I'm giving myself those wrinkles. I don't have those wrinkles. But it's 8 days in. And every day it appears to be less and less. Well, here comes the ears, ears ringing, especially on the left side, louder or more predominant. Which that's where the whiplash affected me the most. I hit my head on the back right side, but this left side was so messed up. Well, my lower back is still messed up. I pull just a few little. Oh, there's a few weeds, and it hurt me. It hurt my back pretty bad. And it could have been that I put on my boots because it was in the evening and I was watering a little bit, and I don't want to get my feet wet, so maybe I'll wear my flat rubber boots. But the problem is, I have to be careful out there because I'm not exactly, well, no, I'm far from steady. I'm not steady. I haven't, I have not worked out once since I injured myself. I mean, I couldn't walk. Well, I keep saying that. It's not true. The day of the injury, I took care of myself all day long, all night long. I iced it for 10 hours. Well, it's a little bit longer than 10. See, I went to sleep for one of those hours. And when I woke up, the back was on my head, melted, which was fine by me. Because I knew that 10 hours was a long time to have iced it. But the next day, on Sunday, I had severe whiplash that started to present itself really bad. I didn't realize to stay way more still than what I was. I didn't quite understand. And so anyway, right now what I'm experiencing burning right here, and it's just kind of all over, and I can feel it in my sinuses. This has presented itself. One of the ways the concussion or the head injury, whichever, has presented itself is with my sinuses. I can tell there's a difference in my sinuses, but I don't. And it does seem like they're a little bit clogged up, but that might have something to do with the cold that Anthony has and I've been fighting. I haven't got sick yet. Yeah, so after my head injury, Anthony started presenting with the cold, and a phlegmy chest head cold. And I'm trying to measure my head injury. And then I'm like, "Oh, you're going to kill me. I'm going to die in your care." I use that word lightly, but I can't. No. He was really like, look, he now realizes how serious the injury actually is. Monday and Tuesday, I couldn't walk without his assistance pretty much. Not very far. It was very scary Monday and Tuesday. And see, I live in a 2-story house, and so I'm up and down the stairs a gazillion times a day. And of course, I'm so messed up at the time that clearly I'm moving way slower. But then when I would get to because of course, and Anthony would be in front of me going downstairs. I wasn't on the stairs by myself. He was in front of me, or I would, there's the walls and the rails, and I'm not like, ugh. But Anthony literally was like my seeing eye human for quite a few days. But so how it's presenting right now is it's in my sinuses, so I can feel it here and all here, just all in my sinuses and face. So it's kind of amazing feeling because I don't know if it's good or bad, but it just, like I said, it's uncomfortable. I don't know what's happening. So it just feels like pressure, a lot of pressure in my, in my teeth. It's pretty regular with this. The ringing is regular. The headiness is regular. The headiness is really, really, really bothersome because it is, it is very difficult to, I hurt my back pulling weeds really bad apparently, but I don't know if that's it. It could be, no, let me restate that. From when I hit my head, my whole hip region up has experienced an extraordinary amount of pain from my hips up. So not in my legs, but let's just go hips, hips, and then go spine, neck, obviously the neck region, the head, and then the muscles in those regions. A lot of pain. And for the first few days, see, I did something kind of unusual and a little bit different than what most people do or would prescribe to do. So I don't know, I would just recommend dialing 911 if anyone ever gets a concussion, especially if you start to struggle with any loss of consciousness. Keep ice on the head and dial 911 immediately. It's not a good feeling. It really isn't, like what I'm experiencing right now. It is, it's just not a good feeling. So I think I just lost train of thought. That's one of the things I was going to say. I'm having some memory issues from room to room sometimes. And, I mean, it's not like extreme, but it's present still 8 days in. And I guess that's why I'm making this video, because I feel very uncomfortable about it. I know that I'm still healing, that this is new, and that my body is taking care of itself, I believe, and I believe it's actually doing a good job. But I feel, it doesn't feel like that. It's just the opposite, because you need to trust that your body is healing itself, is healing you. But it feels like when the burning first presented itself, which was on Wednesday after, clearly. So I was injured on Saturday, the 24th. And, of course, I was in terrible pain, and that's what I was saying. I would not take OTCs because I was worried about a brain bleed, nor would I sleep. The first day after it happened, I slept for, let's see, it happened at 6 p.m. approximately, and then at 4 p.m. is when I laid down, which scared me. So, I have a lot of pillows, and so I actually propped myself kind of up, and then I had the bag of ice on my head. So from 4 to 5 is when I started to kind of think about, that I was going to attempt to sleep, and I didn't want to do, but I knew I wasn't going to be able to run on no sleep. So I set an alarm for an hour, and I slept for an hour, because, immediately following a head injury, you can bleed out, and you can go into a deep sleep, and you can't be awakened. So the goal was to prevent some type of deep sleep, because if you're bleeding, it can be you know, it can be a very slow process. So if you're asleep and you're in a deep sleep and you sleep for a long time and you're bleeding, I don't know. I mean, I guess if you're bleeding when you're awake, but at least if I'm awake, I can pay attention for symptoms. So, yeah, so it was, uh, you want to see something funny? Reuse, repurpose, recycle. This is actually old. From a tea shop in downtown, in the community of which I live. Really good tea, and anyway, I didn't want to throw it away. It's perfectly reusable. So I'm just using it for water when I go outside because it has a lid. Another case, so it's burning right now on my forehead right here, and my gait is a little off. I'm definitely shaky right now because, you know, again, the headiness is. Oh, so anyway, so back to what I was doing. Yeah. Just a lot of severe, severe, severe symptoms. I can't even begin to express to you how severe the trauma that I experienced, and and the pain and the fear of the injury, because head injuries are insidious. They're extraordinarily dangerous, and I had taken an extraordinarily hard blow to the head, goofing around. So, you know, it wasn't, you know, there was no, you know, no foul play, no intent, no malicious, and, you know, just goofing around. In the kitchen over just chicken sandwiches, just being completely goofy. It's the most ridiculous thing you've ever heard. I was like, there is no way. I was telling a friend of mine, I said, there is no way I'm going to let a door take me out. I'm not letting a door take me out. But, or at least I don't want to. I want to fight it. But like I said, 8 days on, and I feel really bad. You know, like right now I'm getting a headache. And this is probably from lack of food. Now, I'm not eating a lot of food either. So to be, in all fairness, I have to say that lack of food is probably not helping me, because sometimes I can be such a weird particular eater now, you know, as I've discussed before, and I don't need to go into again. But so, I mean, I am having issues with food. Matter of fact, I'm about to eat 4 egg whites right now. You know, throw the yolks away. Whatever. I just don't want, I just want to keep the yolks, use the yolks. So anyway, I should just, I don't know if you, I need to look into that because I know that I can't think of it right now. Oh my gosh. I know you can freeze them. Oh, so anyway, you know, there is some memory stuff happening, and that does not make me happy, obviously. So I'm still having some cognitive issues. So right now it feels like the headiness is starting to lift a little bit, but my ears are still ringing, and so there's still that sense of disorientation, which is really new for me. I've been very fortunate. I've been a very fortunate woman my whole life, and I've known this. This is not, you know, this is not any revelation because I seriously injured myself. You know, so I know, you know, right? But so that's just presenting, and I wanted to kind of roll with it because it. I so healthy. I want it to go away sooner than later. So 8 days. I'm traumatized. I'm really like, ugh, happy about it. And I struggled. See, I didn't even go into it, the struggle with my unconsciousness. I have other videos where I talk about it, but I didn't go into it here. I struggled for 10 minutes not to lose consciousness because the person that was there with me, as I started to lose consciousness, I told him to dial 911 and he said no. So I was like, and I was starting to fall back onto the bed. And I was saying dial 911, I'm losing consciousness. And he's just like, no, maybe it's not that serious. And I knew if the ice came off my head, I would be in trouble. So I still think I'm in shock a little bit. And, so I'm struggling a little bit with it. I just don't want it to be permanent, And since it's 8 days in and I'm still experiencing it like right around the same time in the afternoon. And I know it could be a couple weeks, a couple months, it could be a couple years, it could be the rest of my life. And I'm fine, like in between. I'm okay. I feel, stronger and stronger. Right now, my back is still really sore. And like I said, my neck took a hard blow. I'm still terrified to look that way. Look to my right. I don't want to right now, but it does feel, but I don't want to push it because see, as soon as I did that, like it got warm. So I've been working on stabilizing my neck way more, but I could not look to my right. And if I did, even subtly, it was bad. It was real bad. The pain. And I went to be assessed on Wednesday, by an ER physician. And he just did a neurological exam and he felt very comfortable that I do not have a bleed or anything like that. And that it was just, I'm having the normal, effects of a head injury, a concussion. But that's horrible. Yeah, I mean, so anyway, I haven't taken any pain medication because I was worried about dying from a bleed, from anything like that. I didn't want to run the risk. So, my head just feels like so awful right here still. Just 18 minutes on. It was going for about, maybe it started at 2. That's when I noticed the time because I said, okay, let's look at the time. And I mean, this headiness like this. This is where, this is the part that feels like the debilitating part. Because it is, the part that stops me. I mean, it hurts in my mind. It burns, and it's burning right here. And, you just can't think when you're in this place. And it's frustrating. And it sucks, not really having someone that I feel like I can trust to take care of me because Anthony has helped me tremendously. He really has. Even though when he didn't dial 911, I mean, it probably saved my life. You guys, to be perfectly frank, I mean, I haven't really discussed this aspect of it, but I really do think it may have saved my life. Reuse, repurpose, recycle. But I think in a way it may have saved my life because And I decided to fight and not go unconscious. I at least tried not to go unconscious, I guess. That was the goal. Start fighting. And I was like, oh, fuck. And so I had the ice on my head and started to fall back until I went to dial 911. He said, no. Why am I going back over that? I guess maybe that, oh, just the severity of the injury. Yeah, that's what saved, I mean, it may have saved me, because if he had said, okay, and if I'd fallen back, and the ice was not on my head, I could have, it could have swollen and I could have died. It was a very serious injury. I mean, very serious injury. And here it is 8 days later, I'm still dealing with it. And like I said, I know that sounds selfish or silly because it's a head injury and they can take years to heal. But I haven't even been able to dance because my walking is, it's unstable still. I guess I might still just be in protective mode, but just yesterday, I got dressed and, well, I get dressed every day. But, I went into the garden for the first time on Thursday, if that doesn't tell you anything. So from Saturday to Thursday, I didn't step out in my garden. Crazy, huh? And, but that was just stepping into my garden and just turning on the water hose and that very little, and I'm like, I haven't been able to dance since, excuse me. Sorry, that's just from crying and whatever. But yeah, yesterday going into the garden, because I was like, okay, you have to take bigger steps. That's why I'm sitting up here right now again, and I'm trying to keep busy and keep going, but I want to document what I'm experiencing right now. And, but when I went into the garden just to pull some weeds, subtle, I mean, tiny, they're little vine weeds that wrap and they come right out of the ground. It wasn't like I was out there fucking pulling, rooted in crazy. No, we're talking about you can pluck them out of the ground with 2 fingers, like blink, no body, but there were a couple of things I did do. And I think one of them was just stepping. I just stepped wrong and jarred myself because I'm still not right, apparently. And so, it has me concerned, as I suppose it would most people. But, I think I think I'm scared. I mean, I do feel like I'm getting better every day, but it's just like right on schedule now with this headiness in the afternoons. Every frickin' day. I mean, just right on schedule. And the first time the burning started, this, what I'm calling headiness like this, I guess it is when the brain started to heal. So I think it was 4 days. I'm saying because it was on Wednesday when I started to experience the burning and extreme dizziness. And just clearly you cannot think. Okay? You have to imagine someone flipping a switch in your mind being like in a blender. It's just, and that scared me, and I thought something may be happening medically. That I was having a medical crisis. I thought I was having, that head injury was then presenting itself in a new fashion, and that was that I was having a medical crisis, and that I was in jeopardy, that I was potentially having, I was hemorrhaging. Basically, is what I was concerned about. And, or, stroking, we're talking about vascular here. Okay. Brain vascular. And so I went into the ER. It was so like, I just had such difficulty walking, talking, just like, I was like, oh God, am I dying? That was on Wednesday. And, hold on, I'm just laughing at something that I said to the doctor. Oh, oh God. I am so funny sometimes. Uh, I'm not kidding. It was funny. Because he actually laughed. He repeated it and laughed. I went, it's just because I am like myself. Even when I'm terrified once, because I did start to feel more comfortable with him as he was doing this neurological exam. And he won me over when he came back in and said, I know you don't know me, but you can trust me about this. I'm sure you're okay. I really mean that. He goes, I've seen a lot of this. I've been doing this for a long time. He goes, and I'm pretty sure, so, but I know that head injuries, the thing is that they could be bleeding there right now from this injury. And people who know about head injuries can admit that, you kind of take that, but the more time, well, it's not necessarily true. The time doesn't necessarily alleviate, but anyway, it alleviates the majority, but it doesn't alleviate all. But yeah, just scary, scary head injury. So I'm going to go now. This is a 27-minute video, and now it's back here burning. So it just moved. And I do believe that's healing. The burning is healing, I believe. That's what I think, for real. But boy, does it just feels like my head just shuts down. I mean, well, my head does shut down. Everything shuts down. I just get like, Okay. Take care. No horsing around. Watch that noggin. Bye.